Let me ask you guys one other question to kind of wrap this into a total circle, which is the before and after of these procedures. Where does the anxiety tend to lie before? And then with the after question, is there any concern over recovery? And, do you prescribe pain medication? I heard you say no opioids, Dr. Nemeth, but talk a little bit about that.
Well, we always prescribe pain medication, and usually we'll prescribe an antibiotic. Very often the patients don't take the pain medication. And what's the pain medication? The pain medication is ibuprofen. I mean, you can buy it over the counter.
It's just Advil. And many times they don't even take that. But so that's next to nothing,
Yeah, there's usually very, very little discomfort. We give them something, but it's very mild. It's like ibuprofen, and if they may want to take it, and sometimes we actually suggest that they take it not for pain, but for swelling. So in some cases, to keep swelling down, certain NSAIDs or ibuprofen-like medications can reduce any potential swelling that we might expect. And we ask them not to drive the first day because we don't know quite, we want to make sure that that's completely out of their bloodstream. So they have to have a driver, and we prefer that they don't drive at the first 24 hours for sure.
The nice thing about Versed, which Joe and I use a lot of, is it's relatively short acting. So it'll be out of their system virtually completely, probably in 3 hours or less. Yes. So they're not going to they'll be sleepy afterwards, but, and obviously shouldn't be driving, but it's out of their system. That's the beauty of it. You get amnesia, and it doesn't last that long.
Mm.
No, it's been a boon to our patients. It's been a boon to our practice. And I just think it makes it so much pleasanter for the patient. No fear, no anxiety. They may have it before, but once they have the IV sedation, the anxiety simply disappears. They're relaxed, they're comfortable, and we do the procedure. And when we're done, they don't even remember what happened, even though they may be able to respond when we talk to them during the procedure. They really don't remember what went on. It's just a boon. It's a boon. It truly is a boon for our practices and for the patients that we're treating.